Our study had to do with smoking frequency and cancer prevalence among U.S. adults, written by Mark Neith and Olivia Nourie.
So we chose to look at cancer because it's the leading cause of morbidity and mortality within the United States.
We looked at smoking specifically from tobacco use because it has already been studied and determined to be the #1 cause of unnecessary cancer deaths within the United States.
We also analyzed the frequency of smoking cigarettes and whether or not this had a significant effect in someone developing any form of cancer.
Within our two variables, we analyzed the relationship of smoking frequency as well as the development of cancer, but we controlled for three things: age, when a person first started smoking, as well as the time since a person has quit smoking.
For the methods, we had chose data from the National Health Interview Survey for adults, and this was collected in 2011. We looked at 5 different variables to see if there was a relationship between cancer and smoking cigarettes.
Our first question was our outcome variable. It was stated, have you ever been told by a doctor or other healthcare professional that you had cancer or malignancy of any kind? This was the only variable we recoded, so the categorical variable of yes was recoded for 1, 2 was no, and 7 through 9 were our missing variables. Our second question was our predictor variable, and it was, do you now smoke cigarettes every day, some days, or not at all? 1 through 3 were used as is, and 7 through 9 were our missing variables.
We also chose to look at 3 confounders as mentioned before. The first was being age, and the second was how old someone was when they first started smoking cigarettes regularly, and lastly, how long it had been since someone had quit smoking cigarettes. To analyze all of this, we chose to run a binary logistic regression and analyzed to see this data to see if any of the covariates had any effect on the predictor and outcome variables.
This was our graph, and we analyzed a binary logistic regression with smoke frequency versus cancer, but defining it by age. So on this graph, age goes from 18 to 85 years and older from left to right. So as you can see, with every day, some days, and not at all, the highest bars of cancer rates are in the older ages. However, what we found was not at all smoking was the highest risk of developing cancer overall due to the high frequency of bars in that area.
So, in examining the relationship between smoking and its effect on developing cancer, we found that age does significantly confound for smoking and cancer rates, but if someone does not smoke, there's more of a risk of developing some form of cancer.
Overall, we found that smoking every day decreases one's risk of getting cancer by 15%, and smoking some day decreases one's risk of getting cancer by about 31%.
And overall, based on the data that we collected, there's a significantly greater risk of developing some form of cancer if one does not smoke cigarettes at all.
Basically, we know that in consistent results within society today that there are harmful effects from smoking, and our study did not show that, so we feel that there was a limited, it was limited based on the data that was available and the questions that were chosen. So we feel that if there was a different survey, there would be a possibility to have a different outcome, and we think that the fact that they were not able to answer the fact that if they had previously smoked or if they had only smoked at one point in time was controlling for our outcomes.
Lastly, we think that a more successful approach to this study would be, using a cohort design, because it wouldn't be just looking at one point in time, it would be over a period of time. And we would be able to do this without using such a short questionnaire.